show you the surgical bed. So it is the same process of making a closed bed, except you are not mitering the ends of the bed. What you do is you fold up to the edge of the foot of the bed, and then you begin to fan fold to the center. You need to find out what side the resident is going to be transferring on from the stretcher. It is used for people who are coming to the nursing home after a hospital stay. So, and the bed is raised to its highest level, and so the resident would be transferring to this side of the bed. Now, like I said, it's the same as a closed bed, so I'm just going to simulate. I would have already done the process. The top sheet is actually starting at the foot of the bed, then the bedspread is coming about 6 to 8 inches down from the head of the bed, and then I'm performing the cuff. I have not tucked in anything yet. And then I'm going to demonstrate a miter technique. I would actually have the bed higher up for my body mechanics, but that's not the case. So what I'm going to do is miter the bed. Making sure it's a nice crisp line. And then I would do the same for the other. A closed bed would be brought back down to either its lowest point or something that's the appropriate height for the resident. If they were fall risk, I would have the bed completely lowered. And that would be a closed bed. Someone who stays, someone who's been discharged, you're making a brand new linen change, you're completing the bed because no one is going to be in it throughout the day. That is a closed bed. Now I'm going to simulate the making an occupied bed. I don't have anyone to do this, so we have Mr. Bear. Okay. So I'm going to begin the process of the video for making an occupied bed. The beginning task would be, I already washed my hands and I gathered any assembly items or linens that I needed.
Girl. We have an intruder.
We have an intruder, so always making a ruckus. So I'm going to start over because this is take 187. So here we go. I already washed my hands and I assembled any items of linen or equipment that I needed. I am going to knock on the door, I'm going to pause and then enter. I'm going to fully introduce myself and tell them what my title is at the nursing facility. I'm going to ask them for their name or do forms of identification such as a ID band. I ask them what their birthday is and verify that, etc. I need to make sure that I'm performing treatment to the right resident. So I am gathering all my linens already, and they're placed on a clean bedside table. If I'm not sure it's clean, I'm making sure it's clean or having a paper towel as a barricade from the surface and the clean linens. So I never know what I'm going to find, so I always wear gloves for my protection and the patient. If any visitors are in the bedroom, I'm going to politely ask them if they would like to leave. If the resident, if it is their wish that their family stays in the room, then that is okay. I am going to pull the curtain all the way around for privacy so no one can see, and I'm going to close the door from the hallway so no one walking by can see as well. Complete privacy is what I need to provide for the patient. So the first thing I would do is pull off the blanket. You need to make sure that the resident stays completely covered. I would have them hold on. Also, I would raise the bed to the appropriate height, but I cannot do that. Bed rails are going to be up, except for the side I'm working on, having the patient roll when I do the next step. But if there are no bed rails, I need to make sure that I have a coworker here to protect the patient from potentially rolling off the side of the bed. The patient should stay covered the entire time, keeping the blanket away from my body. And I'm going to put this over the chair table or a clean surface. Okay. Now I'm going to have the resident roll over, and I'm explaining the procedures as I do each step to the resident so they're not confused or not taken off guard of what I'm actually about to do. So would you please roll to your left? It's going to roll, bed rails up, keeping him covered. I'm going to remove. I'm keeping the dirty linen away from my body. And then it's going to be tucked underneath the resident. Resident stays covered the whole time. Now I'm going to gather the clean bedspread. Mattress pads are optional if the resident needs it. I'm using a bottom fitted sheet first. I'm pulling that under as well, not touching the open part of the dirty linens. Now, if I were by myself, I would then put this side rail up for the resident's safety, keeping covered the entire time, coming over here, lowering, assisting into rolling to the right. And like I said, I would be explaining this to the resident the entire time. Now I'm going to remove the dirty linen, keeping away from my body. Not touching my clothes, disposing it into the appropriate wastebasket. If contaminated, I'm going to remove my gloves, dispose. Then I would complete hand washing in the resident's bathroom, making sure the resident is safe the entire time. If there are fall rails, that I do not want to leave them alone with both rails down or one rail down. Next, I'm going to put on another pair of gloves. I'm going to bring over the bottom sheet. Making sure it's nice and tight, no wrinkles. Actually, cotton draw sheet. If the resident needed it, I would have done it prior, but it's okay if I do it now. Same thing. This is to help if they have any incontinence issues. No wrinkles, tucking it underneath. Patient is covered the entire time. Now, Mr. Bear, would you please move over? Resident placed in supine. Comfortable. Now I'm going to grab the blanket, bedspread. Oh, I'm sorry, the top sheet. This is the top sheet. So once completely covered, either hold on to the top, dirty top sheet, the clean one, and pull. I would be at the edge of the bed, and pull the dirty linen out, keeping the resident covered the entire time, keeping away from my body, and then going into the dirty linen basket. Making sure no wrinkles. Now I'm going to place the bedspread. I'm always asking the resident if they're comfortable, if they need anything. Now I would miter the ends of the bed. Smoothing out. The hems are always pointed upwards away from the resident. And sides are kept untucked. Now I'm going to change the pillowcase, watching the position of the resident's head, discarding appropriately. Putting on a clean pillowcase. I would now position the bed according to what the resident needs. If it's a lower position versus a normal position where the resident is safe to complete transfers. I would then place a call light onto the resident, making sure they understand where the call light is located and have so they visually and verbally tell me. I'm putting both of the side rails up, positioning the head of the bed slightly up, whatever they feel comfortable at, and they're in good alignment. Taking off my gloves. I'm making sure the bed wheels are locked. I'm going to wash my hands. Going to inform the visitors that they can enter the room, pull back the privacy curtain, and that is it. And clean any equipment that I used or vice versa. Take any soiled linen out in the appropriate bags, and then I would be done with the treatment. Stop.